Hello, my name is Daphne Onifade. Today I'm presenting my PowerPoint presentation on reducing blood culture contamination through evidence-based education in the emergency department. Um, Next slide. All right. Blood cultures in the emergency department helps identify bloodstream infection and guide treatment decisions. Blood culture contamination may cause unnecessary antibiotic treatments. Contaminated cultures can increase healthcare costs and hospital stays. Emergency department faces conditions that increase contamination risk, and reducing contamination improves patient safety and support quality care. The the goal of the project is to focus on reducing blood cultures contamination through education program targeted emergency department nurses at Princess Anne Emergency Room, and program addresses knowledge gaps affecting proper collection practices, and project include development, implementing, and evaluation of educational activities. Literature review finding. Staff education reduces contamination and improve collection practices. Standardized procedures improve specimen qualities and patient outcome. Proper skin preparation decreases contamination during blood culture collection, and ongoing feedbacks and support recommendations during collection procedures. General current policy and practice guidelines. Central Standard requires aseptic technique during blood culture collections. Proper hand washing remain essential before specimen collection procedure, and chloridipine must dry completely before specimen collection, and standardized procedure reduce contamination and improve patient safety. Staff feedback and identify barriers. Nurses report work overload affecting careful culture collections, workflow interruption, reduce concentration during specimen collection, limited time challenge, consistent use of recommended collection steps. Staff requested education feedback and references. Practice variation showed need for standardized education and reinforcement. Education focused on contamination prevention and proper collection techniques. Learning objectives address knowledge, confidence, and practice consistency. Program include hand washing, asepsis, and aseptic collection practice. Mentor recommend practical content addressing identified staff barriers, and educational materials included guides, checklists, and review questions. Implementation of educational program. Education sessions were conducted during scheduled emergency department shift with different nurses and different schedule times. 13 nurses participate in program activity and discussion. My mentor attended all of the session and provided in-person feedback during implementation. And we provided material guided checklist surveys and knowledge assessments, and program was implemented over 2 weeks period. Project outcome and evaluation. The survey results showed improved understanding of contamination prevention practices. Most participants reported greater confidence after completing educational sessions, either one-on-one as a group with feedback demonstration. Educational material were viewed as clear and useful. Nurses report increased awareness of evidence-based collection practices, and staff recommended ongoing education and competency review. Like one of my workmates said, the more they get frequent reviews, the better and more efficient they become in blood cultures and preventing contamination. recommendation and application of nursing practice, continued regular education session, focus on contamination prevention practices, provide annual competency review for blood culture collection procedures, share contamination data regularly to support staff accountability, use quick reference guides to reinforce practices, reducing contamination improvement, patient safety, and professional nursing practice. In conclusion, the practical goal was achieved through successful education program implementation, projects improve understanding of evidence-based practices, experience strengthen leadership, teaching, and communication skills significantly, lifelong learning support, continuous improvements in nursing practice. Future efforts should sustain contamination and patient further. Future efforts should sustain contamination prevention and safety, patient safety. And these are my references. And that's the end of my presentation.